Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be talking about toxoplasmosis infections during pregnancy. So in the last video, we talked about IgG and IgM antibodies and their presence during different stages of infection. In today's video, we're going to be talking about toxoplasmosis infections during pregnancy and using IgM and IgG antibody levels to determine the risk to the baby. So toxoplasmosis infections are relatively common, and the symptoms of this disease is very similar to the common cold or the common flu. And patients generally report feeling unwell, may have a fever or headache, maybe even sore muscles and joints. And because of this, because these symptoms are so common, it's very hard to tell the difference between a toxoplasmosis infection, which may be very serious to the baby, and other more common infections like the common cold or the common flu. So unlike these common infections, toxoplasmosis in pregnancy can be extremely dangerous for the baby. If the mother gets toxoplasmosis during pregnancy for the first time in her life, the baby is at a risk of developing congenital defects. So that's a really important point. Toxoplasmosis infection during pregnancy can cause congenital defects to the baby. And so these congenital defects often include blindness or global delay, mental delays. So very serious side effects to the baby. But what's also important, and what I mentioned earlier, is this is only the case. This only happens if this is a new infection. A new infection. That the mother has never seen before. So the mother has never had before. So she's never had toxoplasmosis in her life, and she develops toxoplasmosis, or she's infected with toxoplasmosis during pregnancy. So how can we test this? How do we know? Do we test this? How do we know that it's a new infection and not an infection that she's had before, she's previously been exposed to in her life? So we can do this by using IgM and IgG antibody levels. And so if you remember from last video, IgM antibodies, if you have high levels of IgM antibodies, this means that this is the first time you've ever seen this disease before. This is the first infection. And if you have high levels of IgG antibody and low levels of IgM antibody, then it's an old infection. It can also be a new infection, but you'll have high levels of IgM as well. Okay, so from what we know in the last video, let's just go through the possible scenarios or the possible situations of toxoplasmosis infection. So I'm going to use the abbreviation of Toxo to mean toxoplasmosis. So toxo infection. So one possible situation is that mother is infected with toxo the first time. So this is the danger scenario. This is when the baby's at risk of these congenital defects. So the mother's been infected with toxoplasmosis for the first time. That's one possible scenario. The second scenario, or the second situation, is that the mother has been infected with toxo before. So the mother's been infected with toxo before. So this is the safest scenario. The mother's already been exposed to toxoplasmosis, so if she develops it again, that's okay. It only happens if it's a new infection that she's never had before. Okay, option 3, or scenario 3, is that the mother has never had toxo infection. So she's never been infected with toxoplasmosis, and she isn't currently infected with toxoplasmosis. So let's just go through the possible antibody levels that we would expect to see in each of these scenarios. So antibody levels. Okay. So in this first scenario, the mother's infected with toxoplasmosis for the first time. What would her levels of IgG be, and what would her levels of IgM be? So feel free to pause the video and think about this, or go back to the other video and watch the other video and try to come up with an answer to this. Okay, so hopefully you've come to the answer that the mother is going to have high or low levels of IgG. So she might have high levels of IgG or low levels of IgG, but she's definitely going to have high levels of IgM. Okay, so this is really what we're looking for in this scenario, is the elevated levels of IgM. So this is very important. Okay, so the second scenario, again, feel free to pause the video and try to come up with what you would expect to see for the IgG and IgM levels when the mother has been infected with toxo before, but isn't currently infected, or is currently infected but she's had the disease before. Okay, so hopefully you've come to the answer of high levels of IgG, and low levels of IgM. So this is the only situation where you've had the mother's been infected with toxo before, is you're going to have high levels of IgG and low levels of IgM. Okay, so lastly is she's never been infected with toxoplasmosis before. Again, feel free to pause the video to come up with an answer for this one. So in this situation, you would expect low levels of IgG and low levels of IgM as well. So she's going to have low levels of IgG and IgM antibodies against toxoplasmosis. So this is a little bit of a complicated scenario, complicated infection. So hopefully this has cleared some things up. And to just address this a little bit further, we're going to go through some examples of real lab results and what they mean. So these are some lab reports that you would get back if you ordered toxoplasmosis antibody levels. So let's just go through these. So on the right here, you would expect to see your patient's information. I've obviously taken that away to keep confidentiality. And you can see here that the first thing that was tested for was toxoplasmosis IgG. So specifically IgG levels. And you can see here from the interpretation of these results that this woman was negative for Toxo IgG. So on the left here, you see that toxoplasmosis IgM levels was ordered. So IgM specifically, not IgG. And you can see, again, interpretation of these results are negative. And so what that means, we're seeing low levels of IgG and low levels of IgM. So that tells us it's option 3, that this patient has never had toxo infection before, and she doesn't currently have a toxoplasmosis infection. So she's safe right now, and her baby is safe right now, but this tells us that we need to screen this woman later in pregnancy. Because yes, she doesn't have an infection currently, but she may develop a toxoplasmosis during pregnancy and go from this third scenario to this dangerous first scenario where she's been infected with toxo for the first time during pregnancy. Okay, so that was one example. We're going to go through one more. Okay, so in this example, again, same type of lab report. You're going to have patient name appear on the right, and the analysis right here, toxoplasmosis for IgG levels, so IgG specifically. And you can see from the interpretation of these lab results that this patient was positive for IgG. So high levels of IgG. So it's definitely not option number 3. Okay, we can rule this one out, but it's possible we have the first scenario, which is our dangerous scenario, or a second scenario, which is our safe scenario. So you can see from these lab results on the left, toxoplasmosis antibodies, IgM was ordered this time. And so you can see that this was considered reactive. And reactive is another word for positive. So this tells us that she has high levels of IgM. So it's not scenario 2 where you'd expect low levels of IgM. This patient is the dangerous patient. This patient, their baby is at a risk for these congenital defects that come with new toxoplasmosis infections during pregnancy. So this kind of patient you want to make sure you consult on. The baby should definitely be monitored closely. So it's important, and hopefully you've understood from these examples that IgG and IgM level testing is important for giving information about your patient and about their status of toxoplasmosis infection.